There's a lot of advertising on the internet and in print ads and billboards talking about cosmetic procedures. A lot of them are directed from a manufacturer of a particular piece of equipment. A lot of them are coming from people doing cosmetic procedures in their office that may not be trained in cosmetic procedures. And it's really important to weed out what's true and what's not. And one of the things I enjoy doing is sitting down and talking with people at length about what is real, what's not real, what are expected results, and what is a lot of fluff that you see in the media that probably is not going to pan out with a particular operation. The one thing I don't want people to do is spend a lot of money and I see this often, so we'll spend a lot of money on procedures that are not really the best treatment for their problem, and then have to come in and spend a whole lot more money to try to get the results that they're looking for, when if they had originally done what was best for them, they would have saved money in the long run, had a much nicer result, and therefore a much happier person. One thing I think unfortunately that happens, particularly nowadays, in the way that cosmetic procedures have become so commonplace and are done by a variety of different physicians, is that someone may come in to see someone, feels that they need a facelift, but yet that surgeon may not do facelifts or may only do one particular type of a lift. And that's going to be the solution for everybody that walks through the door. I think that if you have a range of techniques available, and a board-certified plastic surgeon is going to be able to do much more than someone without that certification and without that additional training. We can really tailor the treatment to maximize the results and get what's expected, both in terms of amount of downtime, the expense, the end result, and oftentimes it may be a combination of procedures that's going to best accomplish things. A lot of times people will come in expecting to have a procedure, but yet there may be something much less invasive and less expensive that's going to accomplish what they want done. And I think that you need to have the experience and the availability of everything from the minimally invasive to the full operation in order to be able to offer that patient what's best for them.
When patients are coming for plastic surgery, they're looking for a place where they feel comfortable and where they feel like they're being educated on their procedures. And that's something that we make sure that we do for our clients, is we make sure that we educate them on the procedure that Dr. Aguiar thinks is the best for them. I think that he really takes time with every client. Therefore, they feel like when they're here, they're the only ones that are here. What I hear the most of our clients that are very happy, they really felt like he listened to them and that he heard what their needs were, instead of just assuming what their needs were.
Not even 2 years, about a year after I had my third child, I just was very unhappy with my breasts. And every couple weeks I would talk to my husband and we'd say, oh, maybe we should get some referrals or what have you, or find some doctors. And I just didn't know where to start. So I asked my obstetrician, who he would recommend, because I know he's seen a lot of breasts, with his profession. And he told me, Dr. Aguiar does beautiful work. So that was my first thing. I went ahead and went to Dr. Aguiar first, and I loved him right off the bat. Then of course, I decided, well, I need to get a couple more referrals, because it's, they tell you should get a couple referrals. So I went to see a couple other doctors, 2 more to be exact, and just didn't feel comfortable with them. I decided, you know what, I'm gonna go back and talk to Dr. Aguiar again, because it felt right with him. He made me feel so comfortable. So we went ahead and did it. And I've never been happier. And I would do it over again.
A lot of plastic surgeons will do one procedure and do it well. I think that not everybody is the same. And when somebody comes to see me for a particular operation, say a breast augmentation, their size is different than the previous patient I've seen. Some may have a larger chest, some may have a smaller chest, different shapes in the size and shape of the breast, different expectations and desires, and not each operation is correct for an individual person. I think that the operation needs to be tailored for that person. So whereas one person I may recommend an incision in the crease underneath the breast because it will hide best, there may be another person who has very little volume and doesn't have a well-defined crease, and they'd be much better off to have an operation with a small incision underneath the arm to hide that incision. Oftentimes when people come in to talk with me, they may not even know the full range of procedures that are available, and my goal is to try to educate them, make sure they understand what is possible and what really isn't possible for them, and then work with them to decide what is the best approach.
If you're interested in cosmetic surgery, plastic surgery, you should do your research. There's a great organization called the American Society of Plastic Surgeons, and they monitor all the board-certified plastic surgeons or board-eligible plastic surgeons. They're a wonderful resource. They have lots of patient education available. It's important to have a board-certified plastic surgeon because they have done the correct training to be able to do cosmetic procedures. Just because someone does a cosmetic procedure, whether that be a surgery or a non-invasive treatment, doesn't mean that they're a board-certified plastic surgeon. It could mean that they've taken a weekend course on how to do a specific procedure. And also, if they're doing procedures in their office, they may be doing them in their office because they're not a board-certified plastic surgeon and can't get the privileges needed to do them at an outpatient surgery center that's accredited or in a hospital.
Board certification in plastic surgery involves a minimum of 5 years of training. I've done over 8 years of training, and I think all of that has added to my skill and my ability to adjust and change the procedure in order to maximize the results for each individual person.
Dr. Aguiar does all of his cosmetic procedures at an accredited surgery center. It's important to go to an accredited surgery center because you know the safety standards that should be met are being met. He also has hospital privileges at 3 major hospitals, Tampa General, Town & Country, and Memorial Hospital. Also, you want to make sure that your board-certified plastic surgeon has hospital privileges to do the same procedures in the hospital as he does the surgery center. Because the hospitals are very strictly mandated by regulations.
My first impressions of Dr. Aguiar was that he was very professional, he was very knowledgeable, he explained everything to me specifically down to detail, and I needed that. He treated me as an educated person rather than I'm just going to do this. So I appreciated that, and it helped me feel confident.
I often encourage people, if they have further questions and they'd like to hear other opinions, to certainly talk with other plastic surgeons. I think as long as you're sure that they're certified by the American Board of Plastic Surgery, listen to what they have to say. See if you feel at ease with that physician. Look at their before and after pictures. I think that's very important, and will give you an idea of what their work is like. And lastly, I feel it's very important that when you're talking with your plastic surgeon that you feel at ease with that person, that you feel confident that they're going to do the best treatment for you, and that remember, this is going to be a long relationship, not just for the time of the surgery, but from that point onward. And if there's anything in the future related to that surgery that you've had, you have somebody whom you feel at ease to talk with about that problem, and can help you through those issues.